firsthand. I actually don't have health insurance myself, so I can relate to many people throughout the Commonwealth who are scared of losing their health insurance. Right now, a lot of folks who are out of work don't have access to health insurance. The pandemic has exposed a lot of inconsistencies in our healthcare system. And if we're not taking care of ourselves and we don't have access to that healthcare, how are we supposed to work? How are we supposed to go to school? How are we supposed to participate in many of the other things? And I think you mentioned this. I do see a lot of the bigger picture. A lot of these issues are not standalone issues. They are intersectional and they affect one another. My father, actually, who has been very sick for a long time, regularly, if it weren't for Medicaid, I do not believe he would be alive today. It is only because he has that health insurance that he's able to stay afloat and see a doctor and get the medications that he needs. Those healthcare programs are very, very important. And so one of my main priorities, and we see this on a national stage, healthcare is a really big issue, especially in the midst of a pandemic.
Yeah.
We have seen 250,000 plus individuals who have passed away from COVID due to
Mhm.
a lack of response nationally. And there's people at risk of losing their health care. What I want to do is create a Pennsylvania that focuses on enhancing patient care, but also making sure that nurses, nurse practitioners, registered nurses have a voice in the process in policies that are being made. I want to make sure that we're expanding Medicaid and Medicare and protecting what we have and not diminishing that, giving people access to that kind of health care. One of the very first things that I want to do when I get elected is implementing a bill that will lower the cost of prescription drugs, especially for our seniors and for those with disabilities. I mean, you look at the costs of even insulin for those who have diabetes. It's enormous. And there are things that we can be doing to make that more affordable. I mean, these are things that help keep people alive. And so why would we not want to do that? I will also pass a bill similar to Washington State that will once and for all put into law no one who has a pre-existing condition will be discriminated against by any insurance company. We can do it as a state. We can pass a law. So regardless of what happens, we can recognize as a Commonwealth that no one should be discriminated based on pre-existing conditions because we know that's something that's at stake should the Affordable Care Act be completely struck down at the Supreme Court level. And in terms of nurses, I want to make sure that they're able to give patients the best care possible. That includes giving nurses safe staffing, so they're not getting exhausted, they're not working long, long hours where they're not giving patients care. My father experiences this a lot because of safe staffing issues. He doesn't get to see a doctor, and this probably happens to many people in the Commonwealth and many people I talk to. They don't get to see a doctor for weeks. And at that point, your symptoms or condition or whatever you're experiencing may worsen over that period of time. There's a fragmentation of care in the healthcare system that we see where when a patient is referred to another healthcare system or another provider, the provider isn't always up to date on what that patient has been through, what kind of care they've received. And so I want to make sure we're tackling that. But I also want to give nurse practitioners full practice authority once and for all. So that way we can provide expanded access care, especially in rural areas like mine, to give more options for patients so they have more healthcare providers to meet with and get the care that they need, quality care that they need.